This is Kendra. She's a happy 6-year-old excited about starting school. At 3, she was diagnosed with mild cerebral palsy. This is primarily a physical disability that impacts her mobility and fine motor skills. She also has poor eyesight and wears glasses to help with vision. She receives physical and occupational therapy regularly. None of that has dampened her joy and sense of wonder. Her parents say she loves learning about animals and singing along with her favorite princess movies. In preparing to enroll her in kindergarten, her parents want to know what type of assistance she'll receive in school, especially as it relates to going from one class to another and being able to sit near the teacher so that she can see clearly. We explain that Kendra's medical diagnosis doesn't necessarily make her eligible for special education or related services. Instead, the school district needs to assess Kendra to determine what, if any, services she can receive at school. Kendra's family isn't the only one confused by this issue. When working with parents trying to receive special education services at their child's school, we often hear that they think a medical diagnosis of a disability or a chronic condition automatically makes their student eligible for special education services or accommodations. Let's compare and contrast a medical assessment and a special education assessment. With a medical diagnosis, a medical professional evaluates the child, reviewing the child's medical history and performing a physical exam and related diagnostic test. This evaluation may result in a medical diagnosis based on specific signs and symptoms. It may also include a treatment plan with medication, therapy, or other support. In the public school setting, licensed specialists in school psychology, or LSSPs, evaluate students and identify if a child meets specific criteria for special education and related services. The evaluation is very thorough. The student records are reviewed, parents may be interviewed, the students may also be given tests or observed while performing tasks. Essentially, the special education evaluation determines if and how the student's ability to learn is impacted by a disability. Once the evaluation is complete, the LSSP documents the information in a full individual evaluation report, also known as the FIE, and provides a copy to the parents and the Admission Review and Dismissal Committee, also known as an ARD, which reviews the information during an eligibility determination meeting. If the committee finds that the evaluation shows that a child meets eligibility criteria, the ARD committee then decides whether a child needs special education and related services to be involved and make progress in a general education curriculum. The committee captures the services and accommodations the student needs in an individualized education program, or the IEP. Kendra's special education evaluation resulted in an IEP being developed that listed the services for which she is eligible. Her parents are pleased that there are accommodations for her to fully participate with the rest of her class and look forward to watching her flourish. The special education evaluation process allows the schools to observe and respond to students' needs individually. What's most important is that children with special needs are seen and supported for all of their possibilities. At the Brighton Center, we help families ensure their children receive the developmental and educational services needed to succeed in school. Use our contact form to connect with one of our special education consultants today.